Welcome back. A Singapore medical team is home after a brief but heartfelt mission at Cairo's Nasser Institute Hospital. There, alongside Egyptian doctors, they cared for children from Gaza, many scarred by war, offering not just treatment but hope. They also shared their expertise in kidney and blood care. And with us in the studio today, Professor Yap Hui Kim from NUH and Clinical Associate Professor Joyce Lam from KKH. Prof. Yap, thank you so much for joining us today. Now let's start with you, Prof. Yap. You know, both of you went down on this brief mission between 20th to 22nd this month. Despite the short time frame, what were you able to achieve in that time? Let's start with Prof. Yap.
I think one of the important things was that the Ministry of Health did send a preliminary team in April. So they actually identified patients there already from Gaza who were already having problems, for example, 2 children with kidney problems already. So that when we went for this brief period, we were able to focus very quickly on the complex medical problems that the kids had.
So we're going to get into detail about that patient as well. But Prof. Lam, how would you say you spent that time, 3 days in the hospital?
So we were involved in complex case consultations, again around a patient that I was aware of from April this year. We also went on ward rounds with our Egyptian counterparts, and on the last day we delivered talks at a symposium and had a good discussion about the cases that we were managing.
Yeah, Prof. Yap, you mentioned earlier that it was quite an intentional trip in that there were already cases lined up for both of you. So in your case, as a kidney specialist, can you tell us about the urgent cases that were waiting for you while you were there and how you tackled them?
So basically, these are Palestinian children from Gaza who already had complex kidney problems. One was a 2-year-old child who had what you would say in medical terms a nephrotic syndrome that was very difficult to treat. So we could share our expertise in how we would have approached such a case, and also the newer therapies that would help this kid remain in a good condition moving forward. And the other kid was a girl who had already been on dialysis, and therefore, ever since the start of the crisis, she had been in Egypt already and had been started on dialysis. And unfortunately, this is a complex genetic problem probably, and will need a complex diagnostic procedures in order to get to the right diagnosis. So that at the end of the day, the planning would be how do you proceed on with the kind of dialysis that you want to offer, and whether we are really going to talk about kidney transplant one day. So these are the kind of issues that we had to discuss with the medical team on the ground.
Right, and Prof. Lam, you're a blood specialist. So in your case, what were some of the cases that were presented to you? How did you help the children that were there?
The case that I was initially consulted on is a very complex case. It's a bit of a tongue twister, but it was called lymphohistiocytic histiocytosis. This child, unfortunately, had already deceased in July because of complication. But nevertheless, it was a good discussion because the Egyptian team, together with myself, were able to discuss how better to diagnose such cases earlier and to intervene perhaps earlier such that the outcome could have been better. And it is interesting because in this particular case, the underlying cause was again probably a genetic disease, but there was some delay in picking up the genetic diagnosis. And we were also able to discuss perhaps how we could come to an earlier diagnosis based on some of the tests that were available then.
It sounds like for both of you, it was more than just being with the children who needed care at that time. It was also about a mutual consultation with the medical team in Cairo itself. So was there anything that Prof. Yap, you felt that was very meaningful in that exchange between teams that could also help to prevent conditions in the future, as Prof. Lam had mentioned in her case?
So I think what is very important is that there are probably going to be future Palestinian children coming to Egypt for care, for example, in chronic dialysis, and especially if they are young infants or younger children, then the care can be very complicated. Where you want to have different modalities of dialysis, for example. And at the Nasser Institute, we did a visit to the dialysis center, and we discussed with the one solo pediatric nephrologist that's practicing there, and realized that they do have some needs in terms of creating an automated peritoneal dialysis program that would help the younger children. So by doing this, we are hoping that in the future, as more and more of the Palestinian children come in for complex care, they will be definitely better equipped to handle it as well.
There's a long-term goal here.
Correct.
Definitely.
So that's why I think it's a specialty long-term goal that we want to help them develop if possible. Yeah.
Right. Now, Prof. Lam, I want to go to you now. Was there any specific case or encounter in the time that you were there that really moved you or that you felt really made an impact?
When we were seeing some of the Palestinian children and their families, I think what came across very strongly was that despite having come from very difficult circumstances, children being children, they were still very happy to see us, to interact with us. And in terms of language issues and all that, of course, the patients and their caregivers speak Arabic, whereas we speak English, but there's still a kind of language that transcends linguistic difficulties. And I think on a certain level, we were still able to communicate with patients and their families.
The language of humanity, so to speak, and that connection, right, between people. So, Prof. Lam, thank you so much for coming in today and sharing your stories with us. I've been speaking to Professor Yap Hui Kim and Clinical Associate Professor Joyce Lam there, 2 of 3 members of the medical team that just returned from treating victims of the Gaza war.